Do you know why so many doctors are leaving medicine? I got a few ideas. Let's see what Dr. Webb has to say.
Why are so many doctors leaving medicine? Every time that you turn on social media, YouTube, Facebook, Twitter, Instagram, there is someone that is talking about leaving medicine.
Before we dive in, I do want to point out the fact that because of social media, it becomes much more visible. People have been leaving medicine since the beginning of medicine, and now we see it much more frequently on social media, and that can give us the illusion that it's happening much more frequently than it actually is. Food for thought.
One of the big reasons is actually burnout. COVID has really put a damper on the healthcare system. There are a lot of physicians who express burnout, and also depression. Suicide numbers are actually going up.
Already a huge issue before COVID, for sure.
So about 8% of doctors, representing over 16,000 practices, shut down in 2020 due to COVID's impact on business. A lot of people are just tired. They're tired of working. It's a lot of stress and responsibility. The litigation concerns that a lot of physicians and practices have. People are just tired.
I think a lot of those practices that were closing, I'm guessing that's largely due to financial issues. With COVID, patients were not going to certain specialists and they were going more to other specialists, right? Depending on them prioritizing their various ailments. So I wonder if that was the main reason more so than burnout, not sure.
Medscape always puts out these surveys where they interview thousands of physicians, and those physicians kind of quoted a number of different things: the work hours, the bureaucracy, the politics, the paperwork, and it was quoted that up to 25% of some people's days they spend doing paperwork. And burnout is a huge issue. The second reason why a lot of physicians are quitting medicine is the loss of independence. Since the COVID pandemic, the number of physician and private practice has decreased.
I'll say even prior to the pandemic, ever since the ACA, the Affordable Care Act, aka Obamacare, private practices have been on the decline. And that's largely due to changes with reimbursement and other systemic changes, and we're actually covering that pretty in depth on the Medical Insider channel, so check that out if you haven't already.
Quote some numbers that 74% of physicians were employed by a hospital or corporate entity in January of 2022. And there's a lot of physicians that will leave medicine if they have to work for a big hospital or a corporation. There are a lot of downsides to doing that. You lose a lot of independence. You don't have that autonomy to just do and practice medicine the way you want to practice. You have your employer telling you how to practice medicine. That's kind of what's going on. Insurance companies, we're losing control. They're mandating that we practice medicine the way that they want us to practice medicine. There are certain insurance companies I have to use a certain implant and surgery because that's what the insurance tells me.
So when it comes to insurance though, that's going to apply to regardless whether you're doing private practice or you're employed in a group, right? So other things you want to consider when you're working as an employed physician would be things like visit time. Do you get just 10 minutes, 15 minutes per patient, or do you get the 30 minutes that you want? Usually it's the former.
Now, this whole healthcare system, the amount that we spend on, our GDP for healthcare in the US, one of the highest out of any countries that are out there, but we have some of the worst healthcare.
Definitely large issues with the medical system overall in the US, but also large issues with the average American lifestyle, diet, lack of exercise, etc.
So a lot of physicians are going employed, especially a lot more after COVID pandemic. You can see the numbers of employed or corporate entity physicians is skyrocketing, 74%. That is crazy. There are a lot of pros and cons to both. There's pros to being an employed physician, but there are a lot more cons also. And some people are just not going to deal with that.
Some of the pros with being an employed physician is that you don't have to worry about running a business and hiring people and all that stuff, because running a business is not easy, right? There is a larger ceiling with regards to your income, but that comes at a price. I've met a lot of physicians who are employed at certain groups like Kaiser where they love the ease. They're like, I used to do private practice and now I'm working at Kaiser and it's just so easy now. I just clock in, clock out, I'm done. There's no minimums. There's no right or wrong. It actually depends on what your priorities are.
Reimbursements are going down. The expenses are going up. The inflation rate, and also looking at Medicare's reimbursements. In January of 2023, Medicare plans to further cut our pay by 8.5%, which is crazy. This is what I encourage those of you out there that are physicians, providers, healthcare practitioners to contact your representatives in Congress Congress to let them know about the HR 8800 bill. This was a bill that was designed to protect patients and also address the systemic issues with the Medicare physician payment system. So the Surgical Care Coalition, well, they reached out to me to just speak about this topic, and I think it's a very important topic to speak about, and I also wanted to use my platform to get the information out there. So what they do is they work with surgeons to minimize or decrease these Medicare reimbursements, because I truly believe that if these Medicare reimbursements actually go into fruition, if they pass this law that says we get paid less, it's going to really impact patient care and the access to care. There are a lot of physicians that are not seeing Medicaid patients, and that's only going to hurt and worsen the already tumultuous healthcare system that we have here in the US. Also is that the reimbursements are going down, especially in spine surgery and neurosurgery, where we're doing really complex surgeries. We got paid a certain amount for that particular surgery 5 years ago. We're doing the same surgery now, but we're getting paid less, but expenses are way up here. So how do we meet in the middle and make things work? And that's why a lot of physicians are leaving medicine. That's why a lot of physicians are leaving private practice, because the expenses are going up. Overhead and how much we have to pay to just make ends meet each month. And sometimes it's a real struggle.
It's a really unfortunate situation, and it affects just about every specialty. It's something I've talked about on this channel and Medical Insiders several times in the past over the last few years. And this is not a solution, but just to add some context and just extra information for you guys, certain specialties are more resilient to that than others. So if your practice can go to a cash-based practice, you're gonna be more resilient to insurance or Medicare reimbursements, obviously. Things like plastic surgery and dermatology allow you to do that, but obviously not everyone the solution is not for everyone to go into plastic surgery, that's not what I'm saying. But just for some context for you guys, when you are considering specialties, think about that. That might be a factor that is not a primary factor, but just something to consider.
There are a lot of different reasons why physicians are leaving medicine: loss of independence, declining reimbursements, increase in expenses. People are being burnt out, less autonomy, more control by insurance companies, private equity firms, corporate organizations. People are just tired. And I don't want to make this video to discourage you from going into the field of medicine. Don't get me wrong, it's one of the best fields out there. I love what I do, but these are some of the reasons why physicians are quitting medicine.
Great video, Antonio. Thanks for making that. I think, yeah, it's important that we discuss this, because this is a systemic problem, and if this keeps going unchecked, it's not gonna end up in a place that we want. We already have, as Antonio said, a shortage of physicians, especially in primary care, and this is only going to compound on that. But I'm curious, what do you guys think is the main reason? Is it burnout? Is it reimbursement? Is it EHR and documenting? Is it lack of autonomy? What do you think that main reason is? Let me know with a comment down below. Much love, my friends, and I'll see you guys in that next one.